Well, Ontario's long-term care homes are in crisis. 299 care homes currently experiencing a COVID-19 outbreak, 956 residents battling the virus, along with 899 staff. And that number continues to go up. 3,491 residents have died of COVID-19, 11 staff members also losing their lives. Because of all of this, 250 doctors now coming together to form Doctors for Justice in Long-Term Care. They're championing a province-wide campaign in Ontario to bring real change to the province's long-term care homes, as you know, are in dire need. Joining me now, two of those doctors, Dr. Dosani. He's a palliative care physician and health justice activist. Family doctor, Dr. Jennifer Kwan, also joins me. Great to have you both on the program.
Thanks for having us on.
I really wish we were having a different conversation about this. You heard the numbers there. Hundreds of long-term care homes just in this province alone, Dr. Dosani, are in dire need, dealing with outbreaks. And we're hearing about, more and more on a regular basis. How did we get to this point?
You know, it goes without saying that what we're seeing in Ontario's long-term care homes is a humanitarian crisis of epic proportions. But the crisis didn't start during the COVID-19 pandemic. It started well before. Our long-term care homes were in a crisis before this pandemic began, from design standards to staffing to supports to the kind of care that our seniors and residents in long-term care really deserve. And what we've seen is those gaps have just been exposed and actually widened. And this is what has led to the situation that we're in now. We're about to pass a milestone where we're going to have more deaths in the second wave than we in long-term care than we had in the first wave. We have one person dying in Ontario's long-term care homes every single hour from COVID-19. If this is not a humanitarian crisis, I don't know what is.
When you talk about the death toll, and we're just breaking the numbers there, over 20,000 deaths now in Canada. And as you mentioned there, Dr. Dosani, majority of those are in long-term care. If we look at the numbers, we hit 10,000, that grim milestone back on October 27th. Dr. Kwan, your thoughts here. As we're hearing there from Dr. Dosani, we are clearly in crisis. It took the military to really highlight what was going on in long-term care. But families and residents and staff had been voicing these concerns for years, for decades. So how troubling is this for you, Dr. Kwan, when we talk about all these numbers and we know that the numbers are going to continue to go up?
Well, this speaks to the importance of advocate voices, including and especially the families of the loved ones in long-term care who know them best, can advocate for them, see the red flags way before the outbreaks are actually declared, and the importance of inspections from people who have no financial benefit or personal gain, but really speaking the truth of what is happening on the ground. And we need their input in order to have a more proactive approach instead of a reactionary approach.
And as a result of that, now you, both of you, along with 250 other doctors, coming together saying whatever action there is clearly not action enough. So, Dr. Dosani, talk to me about justice, Doctors for Justice and long-term care. What's the goal here?
You know, I'm really proud to join Dr. Kwan and now over 1,000 other doctors, researchers, academics to say enough is enough. We need to call this what it is, a humanitarian crisis in our long-term care homes, and we must do better. The medical establishment can no longer stay silent as this humanitarian crisis continues to evolve and doesn't get better. We're calling for an end to for-profit long-term care. We're calling for better staffing, making the work on the front lines of long-term care less precarious. Pay our nurses and PSWs and other staff better. Give them decent wages, paid sick leave. Give them enough work so they're working in one home at a time and don't have to bounce to multiple homes. Empower our essential family caregivers and develop hospital partnerships. We were blown away by the very positive response in our field, but also by the public, and we look forward to making more noise. We're not going to stop.
And it's interesting when you say the amount of support that you've all received from families, from the public, of course, from within the medical community. So, Dr. Kwan, I guess the question will come about saying, these are basic things that you guys are asking. Any human would want to have, the rights to all of this, and you expect that in healthcare. Why has it been so difficult to achieve then, Dr. Kwan?
Well, I think a lot of interventions in the pandemic all boil down to funding, and there is some funding available from the federal government, and hopefully this can be used to change the long-term care homes immediately, not in 4 to 5 years, so that the seniors can be protected, especially with the pandemic going on. There is, sometimes there's a lot of bureaucracy in healthcare, and we lose sight of the people in the long-term care homes, the seniors, the lives, the human beings. But that is really truly is what is most important, and we should not be profiting from the lives of seniors in this kind of crisis.
What about families and their role in all of this? We know some families that are saying, let us help. Let me stay with my family member in the residence. Let me take care of them if you guys are understaffed. What do you both think about the call from families to say, what can we do what can we do to help? Dr. Kwan, your thoughts?
So we've heard a lot from families feeling left in the dark, not knowing about their loved one's COVID-19 diagnosis until days later. Some of them are concerned about speaking out in case that there is any repercussion for their loved ones in the home. So, and earlier on, they were locked out of the home and not recognized as essential caregivers. So we do support the rights of residents to have their essential caregivers and families visit to provide essential care with appropriate PPE and testing and screening.
What have you heard, if anything, yet from the government, Dr. Dosani, on this? I know you guys have come together as a collective group, but the calls from doctors right across this province has been very loud and clear. Have you heard anything from the government? Have you heard anything from the Minister of Long-Term Care in terms of they saying we're going to be working with you?
Our call has been loud and steadfast, and the public has echoed and resonated our voice and our messaging, but we have not heard directly from government and particular politicians and leaders who are really, their role is to protect and save lives in long-term care. And we understand that the current government may have inherited a broken system in long-term care well before this pandemic, but now is the opportunity. This is a call for us to work together to build bridges and connections and a relationship so that we can move forward. Action today can actually save lives in this pandemic. Will our government step up to save lives? I certainly do hope so.
Really quickly, we've seen action being taken already in Quebec, in Vancouver, with those both those provinces taking full action in their long-term care homes. Dr. Kwan, the province says they're going to be putting more money into all of this, hiring more staff, but it's going to take them till 2024 to really see those changes. What are your thoughts when you hear that it's going to take that long?
Well, I don't think we have time to wait right now until 2024. Certainly, I hope the COVID-19 pandemic is over by then. But we need change today, and this starts immediately, right? And of course, we want to keep up the pressure to improve the long-term care conditions both during and after the pandemic so that there are permanent improvements to the broken long-term care system. And we also want to support seniors in other settings, such as retirement homes or living in their homes, to provide more supports in the community and to support seniors and their families.
We will continue to follow this very closely, continue the conversation. Certainly, Dr. Dosani, Dr. Jennifer Kwan, thank you both so much for this and the hard work that you both do and your colleagues do every day.
Thank you very much. Have a good day.
You're welcome.